Hello, Assalamu alaikum. I am Akshay Kumar from class 5th year morning. Today my topic is amitriptyline. Amitriptyline is basically belongs to the class of medication called tricyclic antidepressant. It has a characteristic three-ring nucleus. It works by affecting some natural chemicals like neurotransmitters, for example, serotonin and dopamine in the brain. It has also some sedative and anxiolytic properties. Amitriptyline is basically indicated, or we can say that the rational use of amitriptyline is depression, chronic pain, enuresis, migraine prophylaxis, and neuropathic pains. Commonly indicated tricyclic antidepressants are norepinephrine, which are clomipramine, and escitalopram, which is amoxicillin. Amitriptyline is not commonly used because of some serious side effects. FDA restrict the use of amitriptyline. That's why dosage the dose of amitriptyline for the different age groups, like for adult dose in 0.285 to 0.49 mg per kg person. The single dose is 0.36, which is 6 only IM. It is initial. And for 0.714 to 2.143 mg per kg person, the single dose is 1.4, which is 24 hourly IM, and it is given basically for the maintenance for 6 months. And 50 to 100 mg, the single dose for this is 75, which is also 24 hourly given, and the route is orally at bedtime and increased gradually to 150 mg per day. And the pediatric dosage for the 20 kg children is 0.4 to 0.8 mg per kg children. The single dose is 0.6, which is given 24 hourly orally. It all only recommended for the children of age 5 to 12 years, and it is not recommended for the neonatal age groups, which contraindication. Amitriptyline is contraindicated in the person which is already allergic to the amitriptyline, or the person which have heart problems like myocardial infarction, glaucoma, prostatic hypertrophy, porphyria, liver or kidney problems, epilepsy, diabetes, concomitant treatment with MOIs, because the functions of amitriptyline and MOIs are same. That's why it produce the serious side effects like the increase of serotonin. The side effects which are produced by amitriptyline are the severe or irreversible side effects of amitriptyline include tachycardia, conduction disturbances, postural hypotension, cardiac arrhythmias, congestive heart failure, and the life-threatening effects which include agranulocytosis, thrombocytopenia, and signs and symptoms that are produced after the due to the overdosage of amitriptyline HCl include hypotension, coma, mydriasis, QT prolongation, PR prolongation, and urinary retention, cardiac arrhythmia, seizure, blood vision, and metabolic acidosis, hypoxia, dry mouth, hypothermia, sinus, tachycardia, and the symptomatic adverse reactions include weakness, dizziness, headache, fatigue, constipation, dry mouth, blurred vision, urinary retentions, and tremors. Precautions which are taken if a person use amitriptyline HCl should be used with the caution patient with cardiac disease and pre-existing hematological disorders because basically amitriptyline produces the most side effects of cardiovascular disease and the brain disorder. It is classified as a pregnancy category C drug. Use during pregnancy should be avoided unless potential benefits outweigh the possible risk to the fetus. And the abrupt discontinuation should be avoided because could precipitate symptoms of cholinergic rebound such as nausea, vomiting, or diarrhea. It should be used with caution in patients with history of alcoholism or who may use sedative medicines because the depressant effect on the CNS can be potentiated. Interaction. Amitriptyline basically interact interact with the other drugs like MOIs, quinidine, sertraline, fluoxetine, paroxetine, topiramate, cimetidine, anticholinergic drugs, neuroleptic drugs, and vitamins. Irrational use, or we can say that the use other than the main use because amitriptyline, the main use of amitriptyline is and in the depression and and the other uses are person use amitriptyline for the euphoria which is high or more sociable or dissociative effects including distorted sense of time and numbness. Euphoria is basically is a state when a person feel pleasure or relax, which the misuse of amitriptyline is not uncommon and should be carefully considered prior to prescribing this agent to the narcotic dependent person because the narcotic dependent person use this as a narcos. We should avoid we should avoid to prescribing prescription without any need because it also aid to the cause. Antidote. If a person is overdosed with the amitriptyline HCl, the phyostigmine is used as an antidote for this. Available brands in Pakistan of amitriptyline are amitriptylenol and amylin, amitin. Basically, the dosage which are of two types, 10 mg and 25 mg. We also see the pharmacoeconomic point of view of a person or a patient because because we can't give the amitin which is which is which a price of 150 to a person which can't afford this. So we can give the low cost brand like Amitrip which is price of 43. That's why we also have in mind that we have to see the uh, we have to see the patient condition if he can afford this brand or not. So after this we can prescribe the medicine. So that's all about the amitriptyline. Thanks.